I'm good. How are you? Good. So good afternoon. We're all excited to be here today at the Hynes Convention Center vaccination site to mark the start of a partnership with FEMA to significantly increase doses and access for some of the most disproportionately impacted communities here in the Commonwealth. I want to give a quick update on the Commonwealth's COVID data. Yesterday, the Department of Public Health reported 1,464 new cases. We've now had 18,600,000 tests in total conducted here in the Commonwealth. 675 individuals are in the hospital with COVID, and about 159 are in the ICU. Hospitalizations are down significantly compared to where they were back in the early part of this year. That's in some respects thanks to the high rate of vaccination we've seen for older adults. There's always been a direct connection between age and how likely someone is to suffer serious health effects from COVID. But over the course of the last week, Massachusetts has seen more infections than in previous weeks, and the largest growth in recent cases has been among young people under the age of 30. This time of year, we're seeing most of our cases. This time last year, we were seeing most of our cases in older adults. I think it's fair to say that no one can let their guard down with respect to this virus. It's still far too early to declare victory, and we have more progress to be made, especially with respect to vaccinations, which is why places like this are so important. Now, 80% of our residents over the age of 75 have received the first dose, which exceeds the national average of about 73%, and that helps drive down hospitalizations and cases for this particularly vulnerable group. With respect to vaccines, over 1.3 million individuals in Massachusetts are fully vaccinated at this point, and another 2.2 million people have received their first dose, and that includes the folks that got a single dose of J&J. We continue to lead the nation in administering vaccines to our residents. We are the leading state in both first doses and total doses administered among our peer states. That would be those 24 states that have more than 5 million people. And we're in the top 10 states overall for first and second total doses administered. There are over 200 public vaccination sites available in Massachusetts, and we've continued to ramp up our capacity to be able to handle additional doses from the federal government when supply increases. This week, the Commonwealth received 382,000 total doses from the federal government. That included about 215,000 doses of Pfizer, first and second doses, and 137,000 doses of Moderna, first and second doses. Those numbers also include a one-time shipment of about 30,000 vaccines for J&J for providers, and about 10,000 J&J vaccines have been set aside for the homebound vaccination program we announced last week. An additional 252,000 doses are being sent to community health centers, pharmacies, and the Community Vaccination Center program by the federal government. This week, doses from the state allocation are being distributed in the following manner. Mass vaccination sites are receiving 106,000 doses. Health systems and healthcare providers are receiving 133,000 doses. Regional collaboratives and local boards of health are receiving about 85,000 doses. Mobile clinics that support long-term care facilities, congregate care, affordable and low-income senior housing, and homebound individuals are receiving about 15,000 doses. Pharmacies, as I said before, are receiving about 152,000 doses through the federal retail pharmacy program, and an additional 13,000 doses through the state allocation. In between state and federal allocations, our community health centers are receiving about 87,000 doses. And this week, we will also see a significant increase in doses to ramp up at this mass vaccination site here at Hynes Veterans Convention Center. The Community Vaccination Program, which is a program behind the mass vaccination site, is receiving 42,000 doses directly from the federal government. We'll take every one we can get, right? We're grateful for the support of the Biden-Harris administration and FEMA in designating Boston for a pilot site, and for the strong advocacy of the Massachusetts congressional delegation in supporting our application. I want to thank especially Senator Markey and Congressman Lynch for being with us today. For the next week, the Hynes Convention Center mass vaccination site will have the capacity to administer 7,000 doses a day, with 6,000 doses being provided from the federal government on top of the 1,000 doses the site currently has daily from the state supply. The ramped up capacity will officially start tomorrow. Training's going on right now, and for the federal personnel who've come on board to support the program. And this site will continue to be open to the public. And as with all mass vaccination sites, residents seeking an appointment can continue to pre-register for an appointment at mass.gov/COVID vaccine. There will be no disruption to the appointment or booking process during this expansion. We'll also be working to conduct outreach to the surrounding community to help vulnerable residents sign up for appointments. The Hines is easily accessible by public transportation with major bus routes, the Green and Orange Line, and the commuter rail all nearby, and free parking for 2 hours is also available. The Commonwealth will also be using part of these increased doses to set up mobile vaccination units in Boston, Chelsea, and Revere. We'll have more to share on that program soon. The expansion will also help our administration advance our commitment to equity in the vaccine distribution process and build on the efforts we currently have underway. We've announced over $30 million for vaccine equity efforts targeting the 20 most disproportionately impacted communities in the Commonwealth, and we're launching a door-to-door public information campaign led by Archipelago Strategies Group and Healthcare for All to help residents sign up for appointments and address questions people may have and barriers people may have about getting vaccinated. We also have, as most people know, a several million-dollar public awareness campaign that's focusing on trust in the vaccine, especially for communities and people of color. The Department of Public Health launched a community liaison program to provide liaisons to each of the 20 communities to identify barriers to vaccine access, such as transportation, language barriers, and registration issues. And these liaisons will work with municipalities directly and local boards of health to identify barriers and to create community-based solutions to build residents' trust and confidence in vaccine safety, overcome hesitancy, and increase vaccine uptake in these communities. We have a lot more work to do to reach vulnerable communities, but we have made progress. Over 20% of our Black residents have received a first dose here in Massachusetts, which is more than double the national average of 9%. And 13% of our Latinx residents have received a first dose, which is well above the national average of 7.3%. We'll continue to build on the efforts we have underway to make sure that every person in the Commonwealth who wants a vaccine has access to one. And this expansion here at the Hines in the heart of Boston will certainly help us achieve that goal. Now, while we're making great progress on vaccines, we can't let this progress give us a false sense of security about the fight against COVID being over. COVID is still a serious, highly contagious virus with all sorts of new variants that are making it even more challenging. Vaccines are crucial to getting us back to normal, and we're very much on the way there. But in the meantime, everybody has to remain vigilant against the virus. We can't let our guard down now when we are so close to getting everyone who wants a vaccine access to one. Please keep following all of the public health guidance that's been in place for over the past year. Throughout the pandemic, our administration has issued guidance to stop the spread of the virus, and we've continued to monitor the spread of the virus, and we've continued to update and adjust our restrictions accordingly. Massachusetts still has a mask order in place. You need to wear a face covering when you leave your house. Gathering limits at private residences remain at 10 indoors and 25 outdoors, and you should all work extremely hard to keep informal gatherings small. Businesses like restaurants and other indoor entertainment venues have reopened, but they all have sector-specific public health protocols that they must follow to keep customers safe And between the folks at the ABCC and our colleagues in local government, there are many inspections constantly being put forth to make sure people are complying with the rules. Massachusetts has some of the strictest COVID-19 protocols in place, and they're there for a reason, and we need everyone to continue to follow them and embrace them. People in this Commonwealth have done a tremendous job of battling back against this virus, but we all need to dig in a little deeper for a little longer. If we all do that, we can continue to move forward and get ourselves back to the point where life will feel a little more like it did before the pandemic. But it's important for everybody to continue to wear face coverings, to limit your interactions with people outside your bubble, and to engage in physical distancing. And get tested if you feel sick or you think you've been exposed to COVID. Testing is free. There are hundreds of sites all over Massachusetts, and it's widely available. No one in Massachusetts who thinks they've been exposed to someone who might have had COVID or had COVID should have any concerns about their ability to get tested. There's sites in every corner of Massachusetts. Test results are turned around quickly, on average in less than 2 days. Please get tested if you think you've been exposed, and stay home until you get the results. Testing is an easy way for you to protect yourself, protect your friends, protect your neighbors, protect your coworkers, protect your families, and help stop the spread of the virus. Much of our success with respect to being able to safely reopen parts of our Commonwealth are because of the measures that we have in place and the fact that so many people here in the Commonwealth have abided by those measures and taken them seriously. But to continue to make progress, especially with some of the new variants on the ground, that means every single person still needs to follow the rules to keep everyone safe. Do your part to protect yourself, your loved ones, and our Commonwealth as we enter the final turn of this terrible fight against this virus. I want to thank everybody who's been involved in setting this up with being with us today. I especially want to thank the feds for all of their heavy lifting on making this happen, and we look forward to turning this into a terrific site to serve the people of Greater Boston. Thank you very much. Senator Markey.
Thank you, Governor, so much, and thank you to everyone who has joined us here today. It's my privilege to be here with Governor Baker, with Lieutenant Governor Karyn Polito, Secretary Marylou Sudders, my great colleague in the Congress, Steve Lynch, to Bob Fenton, who is the acting director, administrator at FEMA, to Dr. Rochelle Walensky, CDC Director. Louis Pasteur famously said, "The chance favors the prepared mind." Well, Dr. Walensky's mind was prepared at Mass General, and she has taken that to Washington. And we have already seen the tremendous impact she's had in ensuring that a public health message is delivered to the people of our country to telescope the time frame to solve this problem so that children will have to look to the history books to find that we ever did have such a pandemic. And we thank you, Dr. Walensky, and we're very proud of you for all of the work which you have done, coming from Boston, coming from Mass General. Samantha Phillips, the MEMA Director, Paul Ford, EPA Region 1 Administrator, David Gibbons, Executive Director of the Mass Convention Authority, and Atul Gawande, co-founder of CIC Health. Thank you, Doctor, for all of your pioneering work. We thank everyone for being here. Today is an historic day for the Hynes Convention Center, for the City of Boston, and for the people of Massachusetts. Today we join together to celebrate the first day of operations of FEMA's pilot community vaccination center. And today we set in motion an accelerated pathway to recovery from the coronavirus pandemic. The designation of this site as a FEMA community vaccination center would not have been possible without the Biden administration's incredible response to the COVID-19 and the signing of the American Rescue Plan into law earlier this month. Bob Fenton and Paul Ford and their incredible team at FEMA have been working around the clock with federal agencies, private sector partners, and state and local authorities to accelerate COVID-19 vaccinations to underserved communities, including right here in the Commonwealth. The development of this Community Vaccination Center pilot program is a critical step toward our shared goal of beating the coronavirus pandemic once and for all. This vaccination site has been given the essential resources and support to ramp up vaccination distribution from 1,000 to 7,000 vaccinations per day, and will center justice and equity in our distribution process. With the addition of this site, we will be taking another significant step towards tackling this crisis and helping people make it through these difficult times. Earlier this year, I wrote to FEMA with Senator Warren, Steve Lynch, and our partners in the Massachusetts delegation, asking for our Commonwealth to be considered as one of the pilot community vaccination centers. And this March, earlier, I had a chance to talk to Bob Fenton, once again, to advocate for the site. And today, I get to join with these incredible leaders to witness our partnership in action. And together with Governor Baker and our congressional delegation, we have worked hard to ensure this site could become a reality, especially for underserved communities. Since the onset of the pandemic, Black and Latinx, Indigenous and immigrant communities have suffered a disproportionate burden of COVID-19 cases and deaths. Pre-existing inequities in our healthcare system, from poor air quality to insufficient access to preventative health care, have worsened COVID-19 for our most vulnerable communities. As of today, an estimated 1.2 million people across the Commonwealth have been fully vaccinated, but we have to make sure that disparities in our vaccine rollout are continually being dealt with. We have to do more, and we can't turn our back on these communities who have shouldered the burden of this pandemic. Just yesterday, I had the opportunity to visit a vaccination site in Brockton that is working hard to vaccinate our most vulnerable communities. Brockton is expected itself to distribute 1,000 vaccines a day in the coming weeks, while targeting outreach directly to our communities of color. So what we have right now is an opportunity with FEMA here at the Hines to write on our major public transportation routes to be able to take the necessary step to address the inequities, to stop the needless death in our communities, and to set our nation and our Commonwealth on a pathway to recovery. As Dr. Walensky said yesterday, this pandemic is far from over. Our mitigation efforts cannot stop now. We need to follow the science as we recover, reopen, and rebuild. I had the opportunity to visit an N95 manufacturing site in West Bridgewater yesterday with Steve Lynch that is producing more than 10 million masks a month. We need to continue to wear our personal protective equipment, as the governor said, to get vaccinated when eligible, as the governor said, and to follow the advice of public health officials. This FEMA Community Vaccination Center will serve as a life raft for communities in Boston as we look to recover from this public health crisis. Here at the Hynes Center, we are not only putting shots in people's arms, but we are giving people a shot at a more just, more healthy, and more hopeful future for themselves and for their families. I remain committed to our work to ensure that communities that have been hardest hit by COVID-19 have the resources, the education, and the funding necessary to continue to combat this deadly pandemic. And now let me turn and recognize our great Congressman from the city of Boston, Steve Lynch.
Thank you very much. Thank you, Governor, Lieutenant Governor, my great friend, Ed Markey. Thanks for your great work. To the team behind me, thanks for everything you have done. And Director Walensky, we are so proud of your service, and I just want to say welcome home. Thank you for all your great work. I do want to recognize some others that are here doing phenomenal work. We have 216 sailors who came up, men and women in uniform, came up from Virginia, are helping us at this facility. So thank you very much for your wonderful work. And they are ably assisted by members of the Massachusetts National Guard, the Yankee Division, at the direction of General Keith and also Governor Baker. So we want to thank them as well. I do want to just add to what Ed Markey has said about, we visited a facility yesterday in Massachusetts producing N95 masks. One of the problems that we have right now in this effort is that while we have sent out $10 billion in the federal, and I want to give great credit to my colleagues in the Massachusetts delegation, Senator Warren in the Senate, but also all of our members. Richie Neal was a central architect of the American Rescue Plan Act, Catherine Clark, Jim McGovern, Congresswoman Ayanna Pressley, Congresswoman Laurie Trahan, Jake Auchincloss, and also Bill Keating and Seth Moulton. It was a team effort, and we've worked with our partners here, and I want to make one thing perfectly clear. It has been a partnership with the governor, with the lieutenant governor, with Secretary Sudders in trying to meet the crisis, not only widely across the state, but also where we've been hit the hardest in our nursing homes. And it's been the work of the National Guard coming in and helping us to distribute first of all, do the testing, tracking, and tracing, but also administering vaccines to those most in need. So we are extremely grateful for them. But one of the problems that remains here and that is not being fixed necessarily right now is that the suppliers of PPE, so we've given $10 billion in the American Rescue Plan Act to buy PPE, to buy the N95 masks, the gowns, the gloves, and all of that. The problem is that those companies that are providing that are still sourcing them from China. So even though some companies may be assembling the product, the mask, they may be putting the elastics on here in the United States, and they call them assembled in the United States but sourced overseas, that doesn't eliminate the vulnerability that we have, because we're still reliant on China for providing the materials necessary to protect our citizens. So we're calling upon the medical community, our wonderful, wonderful hospitals here. We've provided $130 billion to our schools to buy their own PPE and protect the students and teachers and to renovate their classrooms. We're asking all of those who were given money to purchase PPE to buy them in the United States. Support that market that we're trying to create here in the United States. We have Shawmut Advanced Materials down in West Bridgewater, in my district, but in Massachusetts. We have companies all over the United States that are trying to provide the product for the protection of United States citizens. That can't happen if we continue to buy product from China. Okay? So we have to get our act together. We have some legislation pending in Washington that would correct the situation. But right now, there's a lot of money out there that's been given to the discretion of states, cities, towns, tribal governments, schools, transportation systems, the MBTA. And we need them to voluntarily use that purchasing power to establish that domestically sourced and domestically produced system of PPE for the people of the United States. This is a gap in our national security that we can address ourselves rather than offshoring that capability to countries that are hacking our federal government, hacking our domestic companies and who are not acting in a friendly and supportive way of our future or in the safety and protection of our citizens. So I am very grateful. I want to thank Bob Fenton. I want to thank FEMA for their selection of Boston. I want to thank again the governor and his staff and all of the healthcare entities in Massachusetts. I don't want to forget, I mean, we have wonderful, wonderful hospitals, but the community health centers have stepped up in a big way. We provided $7.8 billion for community health centers across the country, and there are none better than the community health centers here in Massachusetts. They've done a great job. So it's been a real partnership. We got a lot of work to do, right? We got to keep wearing our masks. We got to be thoughtful of our neighbors. We got to make sure we listen to the governor and to Secretary Sudders and Director Walensky and Dr. Fauci. We got to do the right thing here to protect our own and especially our most vulnerable communities of color that have been most drastically hit by this pandemic. So God bless you all. Thank you all for coming, and stay safe, and we'll get through this together. Thank you.
Well, thank you. For those of you who don't know me, my name's Bob Fenton, Acting Administrator of FEMA, and I just want to start by thanking Governor Baker for his partnership, but more importantly, leadership in collaborating together to establish this center here. Also, I want to thank the senator, the congressman, and everyone behind me, as it really takes a whole community effort in order to successfully be able to ramp up a site of this size and successfully ensure that we vaccinate everyone that needs a vaccination. It's my pleasure to be here today at the Hynes Convention Center in Boston today to continue the nation's work in expanding availability of COVID-19 vaccinations to everyone. President Biden established a strategy in where he set a goal for the federal government to provide 100 million vaccinations in the first 100 days. And also you provided a goal of establishing 100 sites in the first 30 days to FEMA to assist in this. Since then, we provided $4.5 billion to states and local governments to ensure that they had adequate resources. We provided 100% funding to the National Guard. We've deployed over 7,000 responders out to assist in vaccination. And I'm pleased to report that as of yesterday, which was the 67th day since the inauguration, the Biden administration has provided 126.9 million vaccinations to American people. We are currently averaging 2.7 million shots in arms a day. Of course, no good effort goes undone. Now the president set a higher mark, and he wants us to get to 200 million vaccinations in 100 days. I think you agree with me. Working together, we will all accomplish that goal, and it's needed that we do that. And totally, in the 21 sites we set up like this, we vaccinated nearly 1.7 million people at those sites across the country. The goal of establishing these joint federal pilot centers is to expand access to vaccinations that focuses on communities with a higher risk of COVID-19 exposure and infection, specifically in the areas of Boston, Chelsea, and Revere. The additional 6,000 vaccines a day provided to this center for the next 8 weeks are made possible through increases in production and availability. The current plan is for providing 6 weeks of Pfizer vaccination, followed by 2 weeks of Johnson & Johnson vaccination for the last 2 weeks. FEMA is committed to ensuring that the impartial and equitable delivery of its programs and services supporting vaccination efforts. The decision to locate the Federal Pilot Center in the Suffolk County, Boston area was driven by data based on the social vulnerability and populations here in the Boston area. We know these pilots have proved through this administration to support racial and ethnic minorities by increasing the outreach through these 21 sites by double digits over the national marks. We're seeing that in supporting racial and ethnic minorities a national average of about 45%. And according to recent data from the 21 sites we're supporting, almost 60% are racial and ethnic minorities at sites like these. FEMA is working to help drive equitable distribution in states where we set up these sites. We do this through that whole community effort by working with state and local government, by reaching out to faith-based organizations, community-based organizations, private sector, the health organizations, to make sure that we are able to meet those requirements. The center that we're in today is also situated in a high-frequency transit area and provides great mass transit and access to over 1.9 million people in the Commonwealth. This increased capacity of this center is only possible through the work of the whole community. I want to recognize the concerted effort of the Commonwealth, FEMA, our Department of Defense, men and women from the Navy that are here helping us out, the National Guard, and all the other public-private partners that made this vaccination effort a success. I want to end by thanking the Governor for your hard work in getting vaccinations to the people of the Commonwealth, and I look forward to working together through this partnership to continue to vaccinate individuals. With that, let me introduce Dr. Walensky, the Director of CDC. Thank you.
Thank you, Administrator Fenton. Thank you, Senator Markey, Congressman Lynch, and Governor Baker. I'm just delighted to be here with you today. We have so much reason for hope. We have 95 million Americans vaccinated with one dose of a vaccine and 53 million Americans who are fully vaccinated, 15%. As you just heard from the Administrator, we are vaccinating at 2.7 million people a day. And here in Massachusetts, 3.5 million people have received one dose, and 1 in 5 people, 20%, are fully vaccinated. And that is because of partnerships like the one we're standing in today, because of partnerships with hospitals, with federal retail pharmacy programs, and mass vaccination sites like here at Hynes Convention Center. These partnerships have happened with CDC, with FEMA, with state, local, tribal, and territorial partners, all coming together so that we can get people vaccinated. And we need partnerships in the private sector, in the public sector, in communities, in faith-based organizations, so that we can meet people where they are, so that everyone can be a role model. Now, there is some tempered news, and that is that we are currently in this country at 61,000 new infections a day, a 13% increase from last week at this time. Here in Massachusetts, as you heard from the Governor, 1,400 to 1,700 new cases daily. So while we have so much hope on the horizon, we are just asking you to hang on just a little bit longer. Wear your masks, continue to distance, and do the things that keep you safe so that we don't have to see sickness or hospitalizations with COVID-19 for anyone who was supposed to get their vaccine the following week. So right now, I would just say I'm thrilled to see the realization of this site, 6,000 to 7,000 vaccinations to occur per day. I'm thrilled about the partnership. I'm asking you, when it's your turn, please roll up your sleeve and then send the message to your networks, to your community to do the same. In the meantime, please stay safe, and thank you so much for the incredible partnership to make this possible.
Questions?
I think that we all have to sort of take care and be careful doing our masks and social distancing as cases rise wherever they may be rising. And here I would say we are all doing our part. We're masking, distancing, and rolling up their sleeves as soon as vaccines are available. I think that we are in a place now where people understand that cases are rising. They're rising in many places around the country. As they're rising, we're asking people to take their part. CDC has guidance as to different kinds of settings and how people can remain safe in these settings, and would ask people to follow this guidance to make sure that they're safe in those settings. Thank you. I spoke to the governors this morning, and I encouraged all governors to include a mask mandate in their states. And to the extent that states were not having a mask mandate, as we do have in Massachusetts, I would ask citizens to mask regardless of the mandate. I'm not going to comment on individual states. What I will say is I'm really pleased to see that everybody here is masked, everybody outside is masked, and people are doing their part to try and contain the virus here in Massachusetts. Massachusetts has a higher vaccination rate, 1 in 5, than the national average, and I'm really encouraged. I would really ask people to serve in their community to make sure we're reaching those high-risk communities, and places like here at the Hynes Convention Center, as well as the outreach and mobile units in Boston, Chelsea, and Revere is going to do exactly that. Thank you. When I said I had a feeling of impending doom, it is sort of this feeling that I've had surge after surge, serving on the front lines at Massachusetts General Hospital, and recognizing that right now it's preventable. We know that it's preventable. We have the science to prevent. We know what we need to do to stop the surge, and we would ask everybody to go ahead and do that. Thank you.
First time. So first of all, we're pretty much in daily contact with the healthcare and public health community down on the Cape, and are constantly talking to them about testing resources and vaccine resources, and the Cape, among other things, has the highest percent of its population vaccinated of any part of Massachusetts. But we're going to continue to be pretty aggressively involved with them around testing, around contact tracing, around isolation policy and support, and around vaccine policy as well. I mean, there's a lot going on down there, and we're paying a lot of attention to it, and we're spending a lot of time with them on it. Well, there's a regional collaborative in Barnstable that is run by 2 or 3 health centers, a couple of local boards of health, and Cape Cod Hospital, and they're doing a ton of testing as well as a significant amount of vaccinating, and have been for the better part of the past month. And as I said, they have vaccinated more people on the Cape than any other part of Massachusetts as a percent of their total population. Well, I think I'm glad to see that President Biden picked our date, April 19th, as the date on which everyone would be, was it 90% of the population would be eligible to get vaccinated on Patriots Day? I thought that was pretty cool. I think the schedule we've got in place is the right one. We've tried to make sure that people who are eligible by these phases have an opportunity to actually get vaccinated before we go to the next phase. And usually that's about a 2-week window between when we first open one and we move to another. The second thing I would say is that the federal government is putting really significant resources into that retail pharmacy system. In Massachusetts alone last week, the retail pharmacy system went from a weekly allocation of about 72,000 doses to a weekly allocation of 194,000 doses. And that represented literally the entire increase that we got as a Commonwealth. So I think you're likely to see the feds continue to expand that retail pharmacy chain. They're going to continue to put vaccines into the community health center system, which we will work with them on and put some of ours in as well to deal with some of the issues around equity. We're thrilled to have this site here, which obviously will make a big difference for folks here in Boston. And to the extent that additional vaccines on an incremental basis become available, we'll make sure we put them to use right away. I mean, we have the Commonwealth state system, not counting the retail pharmacies, is currently vaccinating at about a 94% administration rate. The doses we get end up in somebody's arm in a really short period of time. Well, look, we spend a lot of time looking at and reviewing the data generally, and we talk on a regular basis with our colleagues in the healthcare community about this, and we do make changes when we think they're appropriate to make. I want to echo what Director Walensky said about wearing a mask and being vigilant. I mean, I can't express how important it is, and we've seen this since last fall, that a significant part of what drives case growth, not just here in Massachusetts, but around the rest of the country, is when people let down their guard. It's not when they're in formal situations like this where everybody's wearing a mask and everybody's distancing and everybody's playing by the rules. It's exactly when you're not doing any of those things. All those informal gatherings. Remember, the single biggest spike we've had in Massachusetts since the summer, last spring was a different case, was Thanksgiving. And we spent a lot of time talking about how concerned we were about how that was going to go, and we had a horrible run after Thanksgiving, and that was driven almost completely by what I would describe as informal gatherings. Well, if you think about some of the ones that have been publicized, the big cluster down on the Cape was a church. The big cluster in Swampscott, which also got a lot of attention, was a party. But I think part of what's driving this is the presence of new variants that, as we've talked about, are more contagious than the original COVID-19. And when we were on the phone with the hospitals this morning, one of them, who does a fair amount of screening of the tests that they conduct for patients and for the community, said that about 55% of their tests were, I think it was UK, wasn't it? Was it the UK variant? 55% of their tests were the UK variant. I mean, that is very much present here, and it's very contagious, and it's why people can't let down their guard, even when they are in informal settings. We were talking about that this morning. I really hope people recognize and understand how important it is, especially for those who haven't been vaccinated, which is, even though 1 in 5 is fully vaccinated, that means 4 out of 5 aren't. That people take seriously this notion that they really ought to spend their holidays with what I would describe as the people who are part of their most intimate circle. And I know for many of us that's incredibly demoralizing, that we'd much rather be spending our holidays, especially these holidays, Passover and Easter, which are probably 2 of the most important religious holidays for us all, with extended family. And all I can say is that people need to be really careful about this, recognize that these variants are very contagious, and factor that into how they make decisions. But we'll know the answer to your question, Steve, about 10 days after the holiday, because that's exactly what happened after Thanksgiving. Go ahead, Steph. I will get you after. Well, first of all, Berkshire County is right behind Barnstable County in terms of who's ahead with regard to vaccinating the largest percentage of their population in Massachusetts. And I know the folks in the command center are on the phone every single day with those folks, and I'm not even sure they knew that letter was coming. We'll obviously respond to it, but there's a lot of dialogue, and I think there's a very positive relation between Darlene and her team and our team on all of these issues. So we've tended to follow the CDC guidance pretty carefully on our phasing. The one exception we made to that was with asthma, and that was because of the overwhelming evidence associated with environmental justice issues around the fact that asthma is so much more prevalent in communities of color, driven in many cases by air quality and by years and years and years of people not really paying much attention to those issues. And I must say, one of the things I'm most proud of that we got out of that climate bill was a very strong series of protocols around incorporating environmental justice issues and air quality issues into decisions that get made with respect to siting and development and all the rest going forward. But do you want to speak to this one, type 1 and type 2 on the phasing list? Yeah.
Thank you for that question. We just updated our list yesterday, and so I think that people are just getting accustomed to what's on this new list. It was revised from those where there was a lot of data versus those where there were less data but suspected, and so I imagine people are just getting settled as to those revisions in the week ahead.
It's all right. I don't mind sitting back and watching. I think what we've learned the most across the country on this is how to focus on the most socially vulnerable populations. That's been the focus of these 21 sites. And I think originally, our original thinking was proximity was important. In some cases, proximity was. In some cases, even though we were proximate in the same location as those with social vulnerable populations, there was vaccine hesitancy, and so then we looked at looking at mobiles and other ways to get out to those communities, building relationships with faith-based organizations, community-based organizations, the healthcare network in those areas. So that's probably the biggest lesson learned is how to do that. And I think if I said the averages nationally, and our average is about almost 15% higher, and that's from that hard work to reach those populations. And it's something we continue to work on each and every site, and we'll work on that here as we get into it. And they're all unique and different. With regard to the 8 weeks, we set the 8 weeks as a pilot, knowing that supply continues to go up. And if you look at where we're at now, we're almost at 100% more supply to states than January 20th. And it will increase in the time going forward. So we felt 8 weeks in heavy population areas with high social vulnerabilities is where we want to focus this pilot on. And then allow states, as allocations increase, to use that increase to go ahead and support additional requirements in those areas. So what we have done for the original 15 sites that we brought on is we extended the personnel, equipment, and supplies 4 additional weeks if they want to use the state's allocation, but there will be no additional federal allocation. Instead, that allocation will be split evenly across the states as supply increases, and they could use that at that site if that's what they want to do.
You know, as part of the announcement from President Biden yesterday to get 90% of people who will be eligible by April 19th, Patriots Day, and 90% of people will be within 5 miles of a pharmacy where a vaccine will be available to them. So that is part of that strategy to make sure that people will be close to access to a vaccine site. You know, what I will say is there's a lot of people at the table making the decisions about these allocations, working towards community health centers has been discussed, mass vaccination sites, federal retail pharmacy programs, and then to the states. So we're working all of the avenues to ensure that we can get vaccine, especially to vulnerable populations, people who have been hit hard from this pandemic. Currently, the data that we have suggests that with the 2 doses of the mRNA vaccine and the J&J vaccine, that the current variants that are circulating, the vaccines will be effective against. However, the more virus that you have and the more variants that are circulating, there's always a risk of more mutation, and that those mutations could potentially pose a risk against the effectiveness of these vaccines, which is why we really are trying to, as we're scaling up vaccination, to decrease the amount of circulating virus. Thank you.
Say again? No, you're talking about the program that we're running? It's already started. For the homebound folks and the local boards of health? Yes, in Revere, Chelsea. Do you want to speak to that one?
Good afternoon. So we're really excited that part of this opportunity with FEMA and the federal government is a hub and spoke model. And so probably starting next week, we will be rolling out mobile vaccines to Revere, Chelsea, Boston, as well as Fall River and New Bedford, because Bristol County can be part of the hub and spoke. So that will start, we're planning for it now, and it should start next week. And it's the whole kit and caboodle. It is the staff, the ambulance, it will come here to pick up the vaccine, so that, right, we always know where the vaccines are. That's very important. So you'll come here, pick up the vaccine, and then take them to a mobile site. And we're really excited that as the administrator said, people will come here, but we also know we need to go out to where people are. This is not the state's decision. The allocation comes from the federal government in terms of the amount that we receive in terms of Pfizer, Moderna, or J&J. So we accept all vaccines that we can get, that we can quickly administer shots into arms and vaccinate as many people that we can in Massachusetts. Do you know? I'm going to hand it over to the administrator.
Yeah, what we've done in all 21 sites is allow up to a third of the 6,000 doses to be used in mobiles. So we'll work with the state to figure out, as we develop sites, how much of that goes out there. But a third, roughly, is what we've gone ahead and worked with other states on. We do the same here.
Something like this kind of a program, that's a conversation we can certainly have with these folks. I don't know how many other sites will have a chance to get here in the Commonwealth, but we constantly talk to the feds about opportunities to expand our footprint and theirs here in Massachusetts. Mike? I think if you look at just across Massachusetts and you look at the percentage of the population that's been first dosed, there's only a couple of percentage points between and among every state, every county in Massachusetts, and in many cases, the difference has as much to do with what percentage of their population in each county is over the age of 65, because that is the population that, for the most part, has been eligible the longest since this process got started. But we spend a lot of time talking to people about not just vaccines, but also about testing and surveillance and contact tracing in places where we have outbreaks. And that's why we've been talking to the Cape, and I know it's why we've been talking to people in Hammond County. I don't think there's legislation pending at this point. The legislation that we filed died at the end of the last session. But if we've learned anything about COVID, is that the rules of the game changed quite a bit. And part of that whole future of work study that we're doing is to study a bunch of things, including the whole question about business tourism, which, as we all know, has been a huge part of our economy for a really long time. Other places get what I would describe as vacation tourism. Our tourism we get some of that, but a big piece, especially in Western Mass, but a big piece of our tourism tends to be more of what I would describe as the business tourism. And there's a lot of debate and discussion about what's going to happen to that. And I do have to go, so I apologize. But thank you again to the feds and to our congressional delegation. And Director Walensky, it's great to have you here.
Thanks very much.